Good morning, everyone. Welcome to the Wilson County Health Department Be Your Own Hero Virtual Health Fair 2021. I am your host, Estrella, and I'm very happy to be here today. So I want to give a warm welcome to all our attendees today watching here live. Thank you so much for being here with us, and I hope you enjoy our presentation. So a little bit of a background on the Wilson County Health Fair that we do annually. This year, we are going to provide information and activities for all our community members. Our community partners will bring awareness of services to benefit all areas of health and wellness. Our partnering agencies will educate and encourage and motivate participants to make positive health and wellness changes in their lifestyles with our local community resources. And I also want to give a big thank you to Therapeutics Alternatives, Inc. and all of our sponsors here. So what does being your own hero mean to you? I want everybody to go ahead and take 2 minutes of their time to be able to think, what does being your own hero mean to you? While I go ahead and give you a little bit of what being my own hero means to me. So I like to take care of myself mentally, physically, and emotionally, so I can go ahead and be the best self for myself and others around me and for my future family. So a little clue, I want all of you guys to be all ears today. So for our giveaways that are coming up soon, we're going to be asking some fun questions so that way you guys can participate with us. So a little bit that's going to be happening today, we're going to have 6 lucky raffle winners. There will be a mobile health screening outside the Agricultural Center from 11:30 a.m. to 12:30 p.m. So be sure to stop by if you want to be tested either for syphilis, HIV, hepatitis C. So that is completely free, that you'll be able to get that service. And to show a little bit of appreciation for everybody that signed up today, we'll be giving some attendee goodie bags. So everybody that registered online or is here today will be receiving one of those little goodie bags. And now for our speakers, some of the speakers that we'll be having today, we have some from East Point, Carolina Family Health Centers, Wilson County Public Library, Therapeutics Alternatives, Inc., Wilson County Department of Social Services, Wilson County Health Department, the Wesley Shelter, and Mediation Center of Eastern Carolina. And now I would like to turn the mic to the Mediation Center of Eastern Carolina Teen Court Program. We have with us here today Jasmine Harris, which is from the Wilson Teen Court Assistant Coordinator, and Charlotte Gree, which is from the Nash & Edgecombe Teen Court Assistant Coordinator. So please welcome them.
Good morning, Wilson County. It's nice to be here and speak to you a little bit about our programs and services with the Mediation Center of Eastern Carolina and the Teen Court Program. I am Jasmine Harris. I'm the Assistant Program Coordinator for the Wilson County Teen Court Program, and I'm joined by my sidekick, Ms. Charlotte Gree.
Hi, good morning. I'm Charlotte Gree, and I'm the Assistant Program Coordinator for the Nash & Edgecombe Teen Court Program.
So we'll get started with just telling you a little bit about the MCEC, the Mediation Center of Eastern Carolina, what we're about and what we seek to do in the community. So we are a nonprofit organization. We were established in 1989, and we work to develop the capacities of the community. So we hope to resolve conflict in the community through a variety of services such as the mediation, education, and facilitation of our program and services. We just help to overcome those barriers to communication in the community and simply be a resource to our families served in Eastern Carolina. Our Wilson office is located downtown Wilson within the tax office, located at 113 Nash Street on the 2nd floor. So we're on the 2nd floor as soon as you get off the elevators. The program and services that we have in Wilson County, we have the Teen Court Program, and we have juvenile mediation services, which are tailored primarily to juveniles. We have court and community mediation as well as anger management. We also will offer workplace training. Next, we'll go on a little bit to talk about the Teen Court program. Teen Court simply seeks to give those first-time offenders a second chance. So we are an alternative program to juvenile justice. The program is designed to reduce the rates of recidivism among the age range of 11 to 17. Our youth clients, they participate in the Teen Court program. They have committed a misdemeanor offense, so we can't take anything above a misdemeanor. And they have to admit guilt so that they committed the offense. Our referrals are received from law enforcement, school administration, SROs, community department stores, and they can be diverted from the Department of Juvenile Justice. One of the greatest benefits of our program is that if a child successfully completes our program, there's no legal record of the offense ever occurring. So it's wiped clean from their record. What makes our program unique are our 7th to 12th grade volunteers. So Teen Court is a peer-to-peer education model, meaning we use our student volunteers for every role in the courtroom. So our clients that I just spoke about previously, they go to a court hearing in a local courtroom in the Wilson County Courthouse, but our peers serve as our prosecuting attorneys, our defense attorneys, our jurors, clerks, and bailiffs. We do use a local judge or local attorney from Wilson County to preside over the court case, but the kids, the student volunteers actually run the court hearing. We hold court in Wilson every second Tuesday of the month at the Wilson County Courthouse at 5:30. So when we receive a referral, I'll walk you through the timeline as far as what that looks like. So again, we receive referrals from school administration, SROs, DJJ, and community department stores. So once we get that, they use a Teen Court referral and they submit it to our program. So it can be submitted by, dropping it off in person, email, scanning, and faxing it over to us. Once we get that referral, we review it to see if it is appropriate for Teen Court, meaning it has to be a misdemeanor offense. They have to be within the age range. And then we proceed to contact the parent and the juvenile. When we speak to the parent and juvenile, we explain what the Teen Court program is and what we can offer them and how it can benefit their child. And then we schedule what we call an informational intake, which is about an hour process where they come into the office and we walk step by step what the 90-day process will look like in Teen Court if they choose to go through the program. The program is completely voluntary, so they do not have to choose to go through the program. If they choose not to, we simply just send the referral back to the referral source. Again, our court hearings are held every second Tuesday of the month. So during that intake, they receive their court date and then they are scheduled for the court date. They're put on the docket and they come to court at 5:30 on that second Tuesday of the month. After court, they begin their 90-day process. So no matter what a child does, if they come through the Teen Court program, they have to do what we call 3 mandatory sanctions. And that includes community service, that includes jury duty, and that includes a 3-hour life skills class. So in that class, we talk about different life skills that may benefit the child, as well as we do anger management with the child in that class. That class is really where we get to the meat of serving these kids in this population. And then finally, after the end of the 90 days, the clients are either terminated successfully, satisfactorily, or unsuccessfully. Successfully, of course, mean they completed all of the sanctions asked of them within the time frame. Satisfactory meaning they completed majority of the sanctions, but not quite all that was asked of them for whatever reason. And then unsuccessfully is completely non-compliance. They're in the program and then we just lose contact with them or they just refuse to complete the program. So now I'll pass it over to Shar for a few success stories.
Hi, you guys. So one of the things that I wanted to touch on that Ms. Jasmine, just kind of ended with was our life skills classes. I want to say that that's probably where we see the biggest change. And so we teach the kids everything from money management. A lot of our kids already have jobs, so we're teaching them, how to budget. We're also teaching them time management. A lot of our kids are going through transitions where, now they have to make up their schedule, or now they have to figure out how they're going to balance sports, how they're going to balance their friends, their jobs, the sports that they play. So we teach them that. We also teach them different ways to communicate, as well as emotional regulation. So how to deal with and also identify your triggers. Some other things that we do is we actually send the kids to follow-ups. And so some of our kids need some additional help. Jasmine touched on anger management. So we actually get them in with our juvenile mediation coordinator, and we have them, learn new skills, learn new tools in order to deal with, their anger or when they're upset. We've also sent kids on to juvenile mediation so that they can get some one-on-one mentor help. We've also sent kids on to Job Corps, as well as Impact Plus for community service, as well as getting them to interact with the Boys and Girls Club. One of the best parts of being a assistant coordinator is when the parents tell us thank you. When they see that there's a change in their kids, when they see that they're using the decision-making skills and the processes, and ultimately when they're getting in less trouble. So our recidivism rates are pretty much at 0%, and we hope to keep them there by just enforcing and teaching these skills that oftentimes the kids aren't getting from home. And people cannot teach, skills and tools that they don't have. So we come in, and Jasmine and myself, we pretty much serve as that one adult that kids need. They say that every kid just needs one adult that believes in them in order to push them. And for the 90 days that the kids are in that program, we're mentoring them and we're walking them, every step of the way. And lastly, another thing that we do is with our juvenile justice class, which is part of the life skills, we're actually teaching them about the system. We're teaching them about laws. We're teaching them about how breaking certain laws, how they will affect them. And a lot of the kids, end up making decisions that, I'm not going to do that again because this is what could have happened. So another thing is when we do jury duty and the kids come back in order to sit on a case for another client. And what they'll do is, they remember what that experience was like for them when they were going through court. And oftentimes, depending on the crime that the juvenile has committed, sometimes our clients are a little bit tougher than, the regular jury members. So it's really amazing when we get to see those changes, when the kids come back and visit us, when the parents tell us thank you. And that's pretty much it for our success stories. Thank you.
So again, we just want to thank you guys for listening to our presentation. If you have any questions, feel free to reach out to myself or Shar. Our contact information is on the screen.
Thank
you so
everyone.
much, Jasmine and Shar, for giving us that information. Any questions will be held at the end. So if anybody does have questions for you guys, then I'll go ahead and forward that information so we can get some answers. Thank you.
Thank you.
Thank you.
And now I would like to present the Wesley Shelter. Donna Pridgeon, who is the Coordinated Community Response Specialist, will be a speaker today. And Nayeli Rodriguez, the Bilingual Outreach Engagement and Specialist, will also be here with us today. So give it up for them.
Good morning. I'm Donna Pridgeon, the Coordinated Community Response Specialist at Wesley Shelter. Wesley Shelter serves survivors of domestic and sexual violence in our community. Wesley Shelter has been serving the Wilson community through its many programs since 1987. What started as a small shelter for battered women has grown to include comprehensive services to all survivors of domestic and sexual violence. Services are tailored to individual need and include our 24-hour crisis line and response for domestic and sexual violence. We have 3 locations. Our office is located at 106 East Vance Street in Wilson. Clients can come to that location to receive services. We also have a safe house for survivors and their children to have a safe place to stay after leaving an abuser. It is in an undisclosed location for the safety of our clients. Sometimes we will relocate the client and their children if it is not safe for them to come to our safe house. We also operate the Clothesline. It's our retail store that's located at 407 Nash Street North, across from the street of Western Sizzling Restaurant. We accept donations of gently used clothing, household items, and furniture to resell them. Our clients are able to go there to get clothing and also receive household items when they leave our shelter. Domestic violence is a pattern of coercive behavior in which one person attempts to control another through physical, sexual, verbal, psychological, or digital abuse. The behavior may occur during the relationship or after the relationship has ended. It can happen to anyone, any race, age, sexual orientation, religion, or gender. It can happen to couples who are married, living together, or who are dating. Domestic violence affects people of all socioeconomic groups and educational levels. Did you know that 1 in 4 women have experienced domestic violence and 1 in 7 men have experienced domestic violence? Domestic violence can include emotional abuse, physical abuse, verbal abuse, economic abuse, sexual abuse, and technology abuse. A woman will leave an abuser an average of 7 times before leaving for good. Many people say, well, why doesn't she just leave? It's not that easy to just leave. Where will they go? Can they support their family? Do they have transportation, childcare, or employment? Children in the household where these types of abuse are occurring are also affected by these types of abuse as well, and many times are being abused themselves. If someone discloses that they are being abused to you, believe them. Encourage them to come to Wesley Shelter for services. Our crisis line is available 24 hours a day. Sexual assault can happen to women and men of all races who are LGBTQ, people with disabilities, people who are elderly, people with mental health issues, and people with substance abuse issues. It can happen to anyone. Individuals who have been sexually assaulted can call our crisis line for help. If the person goes to Wilson Medical Center, the hospital contacts our agency to have an advocate go to the hospital and to be there for advocacy, support, and to encourage them to have the sexual assault evidence collection kit completed. 90% of sexual assault survivors are women. 10% of sexual assault survivors are male. It can happen to anyone. Every 73 seconds, someone is sexually assaulted in the United States. Most sexual assaults are committed by someone known to the survivor, not a strange person. We need to stop blaming survivors of sexual assault. We need to hold rapists accountable, and we need to talk about this issue in our community. We have recently seen many survivors come forward to speak about their sexual assault. We have seen a cultural shift to speak up and speak out about sexual assault. To end rape culture, we must create a consent culture. Respect personal boundaries. Ask for consent before touching or hugging someone. Respect personal privacy. Ask permission before posting pictures or tagging photos online. Consent must be freely given. A person can change his or her mind at any time. Past consent does not mean current or future consent. And when drugs or alcohol are involved, clear consent is not possible. Last year, we had 125 people stay in our safe house. Some stayed a few days, others stayed a few weeks. We served 867 women, children, and male victims of domestic and sexual violence. We provided help with temporary restraining orders, civil court advocacy, criminal court advocacy, protective orders, safety planning, and support through the legal systems. We have an attorney on staff who served 95 families with consultation, representation in court, and many other legal matters. Having an attorney on staff is so helpful for our clients to get the legal advice that they need. We have a licensed clinical social worker that provided counseling to 96 clients. Counseling is so important. Our nurse health educator consulted with 99 women to address medical needs and also to provide health education. We provided transportation for our clients to court, appointments, housing search, school, or work. We also provided childcare services while the moms were in class, attending appointments, or looking for work. 40 children's group activities were well attended, combining education with fun. It's important for children to learn about healthy relationships. Hundreds of women participated in classes, including life skills and job skill training, English as a second language, budgeting, money management, parenting, health, and nutrition. We provided 90 educational presentations to 539 people and 8 professional trainings in the community. We focus on education in our community about domestic violence and sexual violence. And we had 127 people come to take a tour of our agency. Many in our community donated to the clothesline, whose sales help fund our important programs. We could not do this without the ongoing generous support of our Wilson community. Your time, goods, services, and financial donations enable us to make a difference in the lives of others every single day. And now, Nayeli Rodriguez will speak to you about the Hispanic outreach in our community.
Hello, my name is Nayeli Rodriguez. I am the bilingual outreach and engagement specialist for Wesley Shelter. In my role, we like to disperse the services. We have many variety of services we have in Wesley Shelter. We do this by networking with other agencies, working with other agencies, whether it is a community event, whether it is a health fair like this one, or whether, we outreach into migrant camps. We try to reach out to everyone and avoid leaving gaps in the community. I also serve as interpreter and translation. We provide those services in Wesley Shelter as well. We try to work with anyone for those that have limited English language. And now I will translate our services in Spanish. So, mi nombre es Nayeli Rodríguez. Yo soy especialista en divulgación y participación para Wesley Shelter. Nosotros en Wesley Shelter tenemos una misión en poner fin a la violencia doméstica, al acoso sexual y construir personas y familias que sean autosuficientes en nuestra comunidad y educar sobre el tema. Estamos establecidos desde el 1983 y hemos ayudado a miles de familias tener un sistema de apoyo. Esto lo hacemos con la mucha generosidad de la comunidad que nos aporta por medio de donaciones, por medio de servicios, por medio de cosas que nos apoyen para seguir dando nuestros servicios. Nosotros en nuestra agencia proveemos servicios legales para las personas que han sido víctimas o incluso están en una relación donde están sufriendo la violencia doméstica. Tenemos apoyo emocional por medio de nuestra consejera certificada. Tenemos apoyo como si la persona necesita ropa para volver a continuar su vida, si necesita incluso a veces muebles o que cual sea la necesidad mientras esté en nuestras capacidades. Nosotros intentamos ayudar en todos los aspectos y más que nada proveer ese apoyo emocional que nos hace únicos por ayudar a las personas cuando más lo necesitan. Nosotros establecemos también lo que es la instrucción para poder dar lo que es en lo que se trata la violencia doméstica. Muchas personas a veces piensan que porque no hay golpes, no hay maltrato físico, la violencia doméstica viene en muchas partes, se podría decir. A veces no es necesario que una persona te golpee para saber que estás en una relación. Puede haber abuso emocional, abuso psicológico, abuso económico. Y lo que es el abuso emocional a veces también suele dañar, igual que un abuso físico. Todas estas cosas las tomamos en cuenta y sabemos que a veces cuando las víctimas se encuentran en una relación de tal durabilidad, sabemos que las personas a veces es difícil saber que están pasando por algo así. Toma una de 4 personas, de 4 mujeres es víctima y una de cada 9 hombres es víctima. Estas estadísticas nos enfocamos en decir que hay que poner fin a la violencia, son muy altas y a veces también como comunidad tenemos que tomar en cuenta que la educación es muy importante, educarnos sobre estos temas porque no sabemos si nuestra hermana, si nuestra madre, si nuestros amigos, si nuestro vecino, quien pueda estar pasando por algo de esta magnitud. Y ya con esta información podemos enfocarnos en ayudarlos o pasarle la información. Aquí en Wesley Shelter, aparte de tener todos estos servicios, tenemos una línea de crisis que opera las 24 horas para las personas que están pasando por una crisis y desean platicar con alguien o necesitan una asistencia. Pueden llamar al número, es el 252-291-2344. Nos gustaría si cualquier persona que tenga alguna duda, que quiera educación, que quiera, si quieren aprender más sobre lo que es la violencia doméstica, nos contacten. En nuestra dirección estamos en la 106 Van Street en Wilson. Estamos ahí de lunes a viernes de 8:30 de la mañana hasta 5 de la tarde. Nos pueden también, como les dije, contactar por medio de la línea de crisis las 24 horas. Y recuerde que si usted está pasando por una situación de violencia doméstica, abuso sexual o abuso emocional, usted vale mucho y usted no tiene por qué pasar por una cosa así sola. Estamos para ayudarle y hacerla sentir confiable, que tiene nuestro apoyo. Muchas gracias por su tiempo y gracias por escuchar nuestro mensaje aquí en Wesley Shelter. Gracias. Thank you, Estrella.
Thank you so much, Donna and Nayeli, for giving that presentation. Thank you for everything that you do in your organization to help our community members. I want to go ahead and introduce East Point. We have Courtney Boyette, which is a community relations specialist.
Good morning, everybody. My name is Courtney. I work with East Point. I'm a community relations specialist, and I'm going to talk to you a little bit about addressing the mental health needs of our adolescents and youth in a challenging world. All right. Okay, sorry about that. So just wanted to address a little bit about working with youth. This is a great example. We have a picture of an iceberg right here, and this is really what we see in the mental health sector. You often see behaviors or things that are symptoms. It might be lashing out, crying, yelling, things of that nature, defiance. But there's a lot more going on underneath the surface with our adolescents that need to be addressed, and that can come through getting mental health services. So these are just some trends, and we're going to talk specifically more for 12 to 18 years old. They have an increased need for autonomy, and this is kids today. They have a desire for more privacy. They have a greater investment in their peers, and sometimes they are more invested in their peers than they are their actual family members. That seems to be more significant to them. They have a need to try on different identities to see what works, see what fits for their world. And they're also experiencing physiological changes like hormones. Their bodies are changing, their voices are changing like young teenage boys. There's lots of different things that they're dealing with physiologically on top of the emotional part. Right. So these are just some statistics for adolescents and teens. 66% of teenagers say they feel most people do not see them for who they really are. 84% of students say their identities are shaped more by nurture versus nature. And that's kind of an age-old debate in mental health. You know, are you more shaped by your family and your environment, or is it the things that you experience within life? And this is what our kids seem to think. 12% of teenagers spend more time communicating with their boyfriend or girlfriend via Facebook than in person. We say Facebook, but we know there's a lot of social media things out there. There's Instagram, there's Snapchat, different things like that. But a lot of relationships look really different. They're not there in person communicating. It's very digital. 39% of teens have not told their parents about their current relationship, and that can be pretty scary for some parents. So these are some other things that I want to mention to you. Depression and anxiety are ranked number 1 and number 2, respectively, is the most suffered mental illness by teens. So when you think about mental health, sometimes people often, so just kind of reviewing, depression and anxiety are the most common mental illness or diagnoses that we see, not only with adolescents and teenagers, but also with adults. But it's also the most treatable diagnosis out there that we can work with. 46% of teenagers say they have contemplated suicide, and that's a pretty dramatic amount. 73% of high school and college students know someone who is taking medication because of a mental health issue. Taking medications for ADHD, depression, anxiety have become really part of the norm for our adolescents. So I'd be remiss if I didn't talk about trauma. Trauma is kind of a pivotal point in the mental health world. A lot of what we see and work with are that people have experienced trauma, and it manifests in different ways, and sometimes that's in mental health issues. So these are just some different types of trauma. There can be an acute trauma, which is a single event, which is limited in time. There can be chronic trauma, which is multiple and consistent or varied exposure to traumatic events. And then complex trauma, which is a little bit more complicated. usually refers to trauma experienced at the hands of an adult responsible for the well-being of a child. So that can be like child abuse, child neglect, things of that nature. Trauma is different than stress. We all have stress. Stress can be good for some of us. It can also be bad, but stress can motivate us at times. It can give us energy to get things done. But trauma is a little bit different. It's more extreme version of stress. It can change things. Sometimes people feel like their life is in danger. They feel very fearful. They're very helpless. Sometimes they just feel horror based on what they're exposed to. Physical and emotional responses to trauma long after an event is over leaves fear and psychological arousal that lingers as memories. So sometimes people can become very like hyper vigilant. They respond to things in a very enhanced way. Trauma can be very life-changing, and we are recognizing through research now that it's just very important that we deal with it as early as possible to give people a good chance at life. So these are some just different traumatic events that somebody might experience: physical abuse, sexual abuse, verbal abuse. Parental divorce can also be devastating to families when they are disrupted. Being belittled or degraded, bullying might be an example of that. Domestic violence, which we just talked about with the Wesley Shelter. Children exposed to domestic violence can be very traumatized. Witnessing community and televised violence, like the George Floyd and riots, things on TV, people might not be able to deal with that in a safe way. Natural disasters. We live in Eastern North Carolina. We have lots of hurricanes. Sometimes we've had tornadoes. And more recently, we've had COVID-19 that was unexpected, that can be very traumatic for our kids that have been taken out of their element. They've had to learn virtually versus in the classroom. There's been lots of life changes. Losing a loved one, terrorism or war, accident, that could be like a sudden car accident, or even a medical trauma like cancer or having an unexpected surgery. So the reason trauma is so important, we recognize that if people don't deal with trauma or have a protective adult in their life, we know that later in life, they are more likely to have mental health issues, substance use issues, and also medical issues like obesity, and heart conditions. So this kind of shows you, people are more likely to become an alcoholic, develop a sexually transmitted disease, inject drugs, need medications for depression or anxiety or mental health issues, lose time at work because of their multiple issues, commit suicide, smoke cigarettes, which can lead to health problems, have other job problems, and experience depression. We recognize that we have to treat people as soon as possible. Okay. So for substance use, I want to mention this because we know a lot of our teenagers and young adults start experimenting and using drugs recreationally. This changes over time. Drugs are very trendy. We see things, every 10 years or so kind of change. We went from the crack cocaine epidemic to the opioids, for example. But these are just some of the things that we're seeing now. Marijuana is always popular. Synthetics are very popular, like spice, but it can also cause psychosis. So sometimes we get kids that have a history of depression that come in with psychotic symptoms based on their substance use. And these are just some others. I won't read every single one of them, but with Adderall, Vicodin, opiates, hallucinogenics, these are a little bit lower on the list, but we know that kids start to experiment and try different things, more harder drugs as they get older. So these are just some specific situations that we see that we have to intervene from the mental health sector. Sometimes we see adolescents that are suicidal. They express a desire to harm themselves or even sometimes other people. Self-harm as well. We see cutting at times, sometimes teenagers, when they don't have the words to express what's going on with them, they might cut to feel better. Is this what they say? It's like releasing the lid off a boiling pot of water. They don't know how to deal with what's going on with them, and they just want to feel something. So they might start cutting their arms, their legs, their stomach, things like that. Aggressive behaviors. Sometimes our kids are very impulsive. They don't know why they do the things they do. They just do it and think about it later. deliberate aggression, and this can go into like active shooter type thing where people plan to exert violence in the community. And then sometimes with severe situations, we have delusions and hallucinations. These are some of the diagnoses that we often see: PTSD, depression, oppositional defiant disorder. That's people that defy authority. They don't like law enforcement. If you tell them yes, they're going to say no, that type of thing. ADHD, reactive attachment disorder, is something we see with kids with severe abuse and neglect. It's where they bond with strangers versus the people that they're supposed to develop rapport with. Alcohol, cannabis, opioid, and caffeine-related disorders. So resiliency is kind of what's key. We do know, and I mentioned this earlier, that if a person has a protective adult in their life, that can help defy anything that's occurred. It can be any type of traumatic situation, but this is just the definition: the power or ability to return to the original form or position after being bent, compressed, stretched, or elasticity. We know our kids are very resilient and they bounce back from situations. So what do you do if you're experiencing some mental health symptoms? You can call our call center at East Point. It's 1-800-913-6109. We will do a screening, triage, and referral, and depending on the situation, we may refer you for crisis services where you're seen right away, a walk-in clinic, an emergency room, or for inpatient treatment, or we might get you set up with a routine appointment. If you don't have insurance or Medicaid, that's okay. We have funding that can assist. These are just some of the treatments that are available. We do a lot with trauma. We've already talked about that, and trying to reintegrate people to situations they've experienced. But most commonly, we do outpatient treatment. That's seeing like a therapist or a counselor for counseling. Medication management might be done by a psychiatrist or a doctor or a PA. In extreme situations, we may have to put kids in a residential setting or a hospital. Thank you so much for your time today. If you have any questions, please let me know. My contact information is available.
Thank you so much, Courtney, for all that information. If anybody does have any questions at the end, please submit your questions so we can get them to her and they can be answered. And now we have Wilson County DSS. We have Amy Green with us. She is the income maintenance representative, and Amber Dunning, which is the prevention social worker. So I would like to welcome Amber and Amy. Hello.
Hi.
Welcome in.
Oh, hello, how are you today?
I'm doing good. Okay, so I'm gonna go ahead and so you guys can go ahead and get started.
Okay.
Okay, I guess I'm first since prevention information is up. Again, I'm Amber Denning. I'm the prevention social worker with the Wilson County Department of Social Services. It's my pleasure to be here today to talk to you a little bit about our program. Our program is unique, one of the few in the state that's offered at a county DSS. Prevention services is a voluntary program, and we work with families that want to make positive change, set goals, and reach goals. We meet the family where they are, meaning that we come in and help alleviate stress immediately with the family. We have several ways that we can work with a family. We provide several types of services. Some of the things you must have to participate in prevention: you must have a child in the home under the age of 18. I also ask that you are fully committed to your goal and fully committed to working with prevention and participation. And it really has to be the family's plan. We're just here to assist and advocate and see if we can help families achieve their dreams, really. When we go in to work with a family, we meet one-on-one, we talk and listen to what's going on with the family and the dynamic, and with the children. And then we work with that parent individual to set goals that are positive change. It could be many things. We work with families around employment, housing, parenting, education. It could be anything that a family wants to achieve. We go in and discuss what's working well, and help families set plans for next steps. A lot of times the stumbling block for all of us is how we can get from where we are to somewhere else. Change is hard. It's hard for all of us. So we are change advocates and change catalysts. We identify programs and services and resources that may be helpful. We suggest ways that you can improve your relationships with your children. And we can even do, as I said, one-on-one customized parenting sessions, because a lot of times when you're in that difficult situation with your child, it's hard for you to see the light at the end of the tunnel, and having somebody else to come in that you can depend on and work with really helps to alleviate stress, because we all know if you have children or have children that you love in your life, that it can be difficult at times. And we can suggest ways you can improve your relationships with your children. Also, I wanted to mention some ways that we have helped in the past and we can help is with employment. We've helped people with job search. Resume assistance is offered at Wilson County Department of Social Services. Parenting education. We have a Strengthening Families program that's an intensive 14-week program for children 6 to 11 that starts in August. And you can call the agency, and the contact number will be up in a few minutes that you can get connected with that. Daily living skills and organization, connections with mental health resources to East Point, referrals to providers. I'm sure that some of you have heard in the previous presentations about some of those things. We can help you maneuver through that process. It can be a little cumbersome at times. Crisis management. Every family has crisis, assistance with finding resources when you have financial burdens or mental health problems. Advocacy with schools for your children. That can be a challenge at times when there may be learning difficulties, delays, behavior problems. Budgeting, financial management. I'm a certified financial social worker as well as other social workers at DSS. Housing resources, childcare resources, and help to manage life's crisis. And that is mostly what I have. And together we can help you make positive change in your life. So if you have any questions, I know that the representatives, the health department representatives will get that to me, and we can do our best to answer that or help you in any way.
Okay. Thank you, Amber. I think it's my turn now to talk about, like I said, I'm here as a representative of Economic Services, which is represents the our food and nutrition services program, as well as all of our Medicaid programs. I thank you for having me today to talk about it, what we offer. Our food and nutrition services program used to be called food stamps back in the day. For those of who's been around about as long as I have, you would remember it called that. Our goal with that program is to provide a supplemental assistance to families to purchase food for their families, and our goal and our hopes for that through this program is that the individuals will be able to purchase more nutritious meals, because we all know groceries can be a little bit on the pricey side from time to time, especially when you're trying to buy fresh fruits and vegetables and things like that. So our hope for this program is that it will allow people the opportunity to assist them to purchase more nutritious meals for their families. Our food assistance recipients receive their allotment on a card every month. There have been a lot of different benefits and that have been approved throughout our COVID pandemic time period. We've been under what we call several waivers for that. So there have been some additional benefits that have been approved for our recipients, as well as for those individuals who have children that are in school within in Wilson County, have received some additional benefits through that program. So we've had a little bit of a opportunity there to assist more people than what we have normally been assisting. And I do encourage, while it's true for the food assistance and Medicaid programs both, while it is true that yes, there is an income limit for those programs, I do encourage you, if you feel like it's a program that you would be interested in or you would like to see if you would be eligible for, I encourage you to go ahead and make that application to see if you would be eligible. You may not be eligible for a full allotment amount, but we have a lot of people who are eligible for partial amounts. So please, take the opportunity to and when I get finished, I'll talk to you about the different ways that you can apply for benefits there. We also have our Medicaid programs. Now, our Medicaid programs are a little different because we have them, they are divided into different sections, because we have one section of Medicaid that does nothing but Medicaid for the elderly and disabled. And that section, that also includes our section where for individuals who need to go into possibly some type of facility, whether it be a long-term care facility or maybe they need extra assistance for them to try to stay at home. Our goal is to try to keep help our families to be able to keep their loved ones at home as long as possible. So if you are able to get the Medicaid while you're still living at home, sometimes that can help prolong, getting the correct medical care can help prolong any type of reasoning that might cause you to have to go into a facility at some point. So it is our goal to try to help folks stay at home as long as they possibly can. We also, the other department of our Medicaid, that is the Medicaid that handles with families, with children. We have programs for kids that go up through age 21. We have programs for parents of children. We have programs for pregnant women. And we have a program for individuals who only want or are only eligible for family planning type services that we can offer, which is also we have a lot of participants in that program as well. And our Medicaid folks that I will say this though, that there's an income limit for those programs, but the income limit for our children, especially, and our pregnant women is pretty high. So, if you are not currently receiving for your kids, or if you know someone who might have children that may not, especially if they are unable to be covered under health insurance, then you may want to encourage them to try to apply for our Medicaid program, because we do have, while we have Medicaid, and then for individuals who have children that are over the income limit for Medicaid, we also have a program called the North Carolina Health Choice Program, which is a health insurance program for children who are over the Medicaid income limit. And the income limit for our Health Choice Program is quite high as well. So you may, like I say, you may have children that if they're not eligible for Medicaid, then they may be eligible for that program. Our goal is to, again, to help our families to be insured as well, so that they can get medical care, especially for their children, that they can get their preventive well checkups timely, and that they can assist. And we do partner with, other programs. We are currently right now in the process of our Medicaid programs are going through, for those who already receive Medicaid, our managed care. They will be administered by different, actually, health insurance programs versus the state Medicaid come July 1st. So we're working on that diligently right now to be sure that all of our customers are educated about that, and they make contact with the managed care brokers to choose their healthcare provider. So I will say, if any of you receive Medicaid, or if you know anyone who received Medicaid and they have received a packet in the mail that says, hey, heads up, we're switching over our benefits, please ask them if they have not already contacted the number on the packet, so please do so, because it's very important that give them the opportunity to choose their own medical provider, because if not, the state will be doing some auto assignment for individuals who do not make contact with them. For anybody who, if you have any questions about, and obviously, like Estella said, if you have any questions that you would like to forward to us after the meeting, I will be happy to respond to any questions that you may have. But if later on, if you think about that, you have any questions, you can certainly call us. We have a customer access center at Wilson County DSS that you can call anytime between the hours of 8 and 5, Monday through Friday, and they will answer any questions that you have about food assistance or Medicaid, either any of the Medicaid programs. And we have caseworkers that are staffed there continually, and they're very eager to help you. You can call the 206-4000 main number, and that will automatically flip you to the customer access center. You can also, though, if you're not available to contact us during those hours, you can also contact us by email. Our email address is ccenter at wilson-co.com. And we have someone who manages those emails every day, and they do respond to them. If they come in before, say, 4 o'clock in the afternoon, you can be sure they're going to be responded to the same day that we receive them. Because it's very important, educating the community and educating our customers about what we offer and what we can do. And oftentimes people will contact us, and you may contact us about food assistance or Medicaid, but if you have other issues, we can oftentimes refer you to other resources as well. If you are struggling with other areas that you might like to, or might have a need for participation in another program. And again, my name is Amy Green. I really appreciate the time that you've allowed me today. I hope that it has been informational. And like I say, if there's anything else we could do for you, if you have any questions, please don't hesitate to call us, because that's what we're here for.
Okay, thank you so much, Amber and Amy, for that information. Like you guys said, if anybody has any type of questions at the end, you're welcome to reach out to them through me, or you guys can email the email that you mentioned previously. Thank you. We want to welcome Carolina Family Health Centers. We have today with us Carrie Green, Director of Communications, and Keandra Johnson. She is a dental health educator. So please welcome them in.
Good morning, everyone. I'm Carrie Green, the Director of Communications for Carolina Family Health Centers. I also have with me Keandra Johnson, who's our dental health educator, and I am standing in for Irmak Sharad, who is not able to join us this morning, but she is our behavioral health educator. So Carolina Family Health Centers is a community health center, and we operate 4 locations in Wilson, Nash, and Edgecombe counties. And we're also a migrant health center. And the mission of our organization and the goal of our organization is to provide comprehensive and culturally competent, cost-effective care to our patients. And that care includes medical services. We have medical providers who offer primary care services, preventative care services. We also see patients who are living with HIV and AIDS. We have pharmacy services. So we have pharmacies that are in each one of our 3 medical centers. We have dental services. We have a standalone full service dental center that is in Nash County in Elm City. And Keandra is going to talk to you a little bit more about the services that are offered at our dental center. And we have behavioral health services offered at each of our 3 medical centers. And our behavioral health specialists, they are licensed clinical social workers, and they are able to work with individuals for a variety of behavioral health needs, anything from depression to diabetes education. We see all patients. We have pediatrics and adults, both in our medical and our dental practices, so we can see the whole family. We accept most insurance plans. Private insurances are accepted, Medicare, Medicaid, and then for those individuals who don't have insurance or may not have enough insurance coverage, we offer a sliding fee discount program where we're able to discount medical rates based on household income and household size to prevent finances from being a barrier of care to those individuals. We have Spanish interpreters at each of our facilities. We also offer other translation services for other languages. And we offer free transportation and medication delivery. So when you call and schedule an appointment, if you're not able to get to our center, if you don't have a vehicle or it's too far of a drive, then we will actually come pick you up, take you to your appointment, wait for you, and then take you home. And we do the same with medication delivery. Once a prescription is filled in the pharmacy, we'll deliver it to the patient. Not mentioned on this slide are two other services that we have been heavily involved in this year, and that is COVID testing and also COVID vaccines. So 5 days a week at our Wilson Community Health Center location and also our two other locations, we offer COVID testing. We have a hotline. The phone number is 252-243-9800, option 0. And that will allow you to speak with a medical provider who will assess your symptoms and then put you on the schedule for curbside testing at our locations. And then for vaccines, we are currently offering the Johnson & Johnson vaccine and the Moderna vaccine. And the phone number to schedule those appointments is 252-243-1257. These are our 4 locations at the Wilson Community Health Center, which is downtown Wilson. It was established in 1995. Our organization has been around for a little over 25 years. We also have Freedom Hill Community Health Center, which is located in Tarboro in Edgecombe County. We have Harvest Family Health Center, which is located in Nash County and Elm City, and those are our 3 medical centers. And then the Carolina Family Dental Center is also located in Nash County and Elm City. It shares a parking lot with Harvest Family Health Center. So Irmak had prepared an activity for you all today that she wanted to walk you through. And throughout the pandemic and even in non-pandemic times, our mental health is extremely important. It's been talked about several times today during this forum. And we just wanted to share a few activities that you can do at home to just ensure your mental wellness. And some of those activities are very simple. It could be taking a walk and getting fresh air. It could be meditation, deep breathing exercises, but the one that we wanted to walk through today is called a gratitude jar. And this is something that can be done with basic household supplies, like a jar, a few pieces of paper and a pen. It can be done by anyone, any age in the household. It could be a family activity. And the way that you put together a gratitude jar is for a set period of time each day, you would take a sheet of paper and write down things that you're thankful for. And they could be big things or they could be very small things, such as, the sun shining today. We've had several days of rain and it's nice to see the sun. Or if you're a gardener and you haven't had rain for a few days, or actually I think it's been a few months, you can be thankful for the rain that we've had recently. So for several days, you and your family would write down what you're thankful for and place it into the jar. And then after a set period of time, whether it's a week or a month or a year, you could go back through that jar and pull out the sheets of paper with the things that you're thankful for. And it just puts your life back into perspective a little bit and makes you realize all of the many blessings and the great things that you have on a daily basis and gives you something positive to look forward to. And now I'm going to pass it over to Keandra, who's going to speak to you about the importance of good oral hygiene.
Hello, good morning, everybody. My name is Keandra. I am the dental hygienist and oral health educator for Carolina Family Dental Center. So just to tell you a little bit more about our clinic and our services, we are open 5 days a week, Monday through Friday from 8 to 5. We also have a late night clinic on Thursdays. We close at 7. We take our last appointment around 6 or 6:30. Some of the services that we offer are dental exams, dental x-rays, cleanings for both adults and children. So if your child has a tooth, they're more than welcome to come in and get screened and get a little cleaning. And that way they become comfortable in the dental setting. They become comfortable with people in their personal space, looking in their mouth. So when they become of age, and it's really important to get dental care, they're already comfortable and willing to let us do what needs to be done. We also offer fillings, extractions, partials, dentures, crowns, bridges. And if it's anything that we are not able to provide inside our clinic, we also work with a multitude of specialists in different areas that we can work together and refer you to make sure that your needs are met. Let's see. So next, I'm going to hit on a few points about practicing good oral hygiene. So the mouth is the gateway to the entire body. So just like you go to your medical provider once or twice a year and you get a clean bill of health, it's good to be in tune with the dentist to get a clean bill of health with your mouth as well. Because any harmful bacteria that's found in the mouth can very well travel through the rest of your body to vital organs such as your heart. So one tip is to brush twice a day. You want to make sure that you're brushing in the morning as well as at night. And you want to brush for at least 2 minutes. So a lot of people think that brushing in the morning is the most important, and they tend to forget to brush at night. So actually, nighttime brushing is deemed the most important time to brush your teeth, simply because when you sleep at night, naturally your mouth becomes drier because you're not up, you're not moving. So your saliva is not flowing and washing away that bacteria like it is during the day. So naturally, everybody's mouth becomes drier at night. And then if you're taking certain medications, for example, high blood pressure medication, has a side effect of dry mouth. So that increases the level of dry mouth that you have. So if you clean your teeth thoroughly at night before you go to bed for at least 2 minutes, then that decreases the amount of bacteria that's present in your mouth while you're sleeping, which decreases your chances of developing cavities. You also want to make sure that you're flossing every day. Flossing is a thing that a lot of people tend to forget or skip over. So the toothbrush is meant to clean around your teeth, and it's meant to clean on top of your teeth. So microscopically, the bristles on the toothbrush, they're too big to clean in between the teeth. So all the food and buildup that has gotten stuck between your teeth throughout the day, if you don't floss, that's being left behind. And that's the number one way that cavities tend to form in between the teeth is when you don't floss, or you don't floss on a consistent basis. So most importantly, if you can brush 2 times a day, make sure you brush at night before bed. Make sure you floss at night before bed. It's really up to you as far as if you want to use the floss picks on the stick, or if you like to use a string. We don't have a preference, whatever is most comfortable to you. That way you can decrease your chances of any cavities developing at night while you're experiencing that drier environment, and be on the safe side with that. Next, I want to talk about finding a dental home. So just like I said, you have a medical provider that you work with to take care of your body. It's important to have a dentist that you work with to take care of your mouth. So we ask that you come to the dentist at least twice a year. We do x-rays at least once a year. So that way we can catch problems before they start. Once things start to hurt, sometimes it can be a little bit too late, or you end up having to get a more extensive procedure versus if we would have caught it when it first started. Maybe we could have done a little small filling, and that could have saved you, some money as far as having to get an expensive procedure done. So to backtrack a little bit more, we accept private insurance, we accept Medicaid. And then we also have a sliding fee scale. Just to give a ballpark figure of finances, if you do not have insurance, our lowest tier as far as income copays are $50, and our highest tier is $130. And those all our services are discounted based on what tier you fall in. Like Carrie said, we do offer transportation services. So if you do not have a way to get there when you call and make your appointment for your new patient exam, just let the front desk know that you're in need of transportation services, and they'll get that set up for you. And like she said, they'll bring you to your appointment, they'll wait for you, and then they'll also take you back home. So if you do not have a dental home and you're interested in coming in, getting established, feel free to give us a call at 252-443-7764, and we'll be more than happy to get you in as a new patient. We'll take some x-rays, we'll do an exam, we'll take a look at your gums and your bone level to make sure you're not showing any signs of gum disease, and come up with a full customized treatment plan, and go over prices and payment plans and all that good stuff to get you back on the right track. I thank you guys for tuning in, and I hope to see you at the dental center soon.
Thank you so much, Carrie and Keandra, for that useful insight. I myself do, I have a gratitude journal, so I fill it out every day. I write things that I am grateful for. Just 3 small things, like Carrie said. It can be either big things, like I woke up alive today, or I have good drinking water, or I woke up in a bed this morning, things like that. And then good oral hygiene is always great. So if you guys have any questions or anything like that, you're welcome to reach out to them. And now we'll be moving on to Therapeutics Alternatives, Inc., presented by Melissa Lyde. She is the GAS team lead. We have Vicki Hale, and we also have Crystal Robertson. So they actually submitted a video to us. So we're going to go ahead and play that for them. And these are the pictures over here, so you could recognize their information. So here it goes.
Hello, everyone. I would first like to thank Wilson County Health Department for hosting this phenomenal community event and providing us the platform to share with you all about our educational services. I am Melissa Lyde, team lead for the East Point Geriatric Adult Mental Health Specialty Team. I have 2 wonderful colleagues, our registered nurse, Mrs. Vicki Hale, and our qualified mental health professional, Mrs. Crystal Robertson. We service the Wilson County area along with Greene and Edgecombe counties. So what is it that we do? We provide you with free mental health, behavioral intervention, and cognitive disorder trainings focusing on the older adults. Our geriatric mental health specialty team is employed by Therapeutic Alternatives Incorporated. This company is a family-owned and operated service provider since 1958, and they are located in Randleman, North Carolina. They are our service providers for people with developmental disabilities, mental illness, and/or substance abuse problems. They are also nationally accredited by the Council on Quality and Leadership. Now, our contractors is East Point LME MCO. They are the managed care organization who assists us with providing the geriatric adult mental health specialty services. They are dedicated to working with individuals and families such as ourselves in the Eastern North Carolina who struggle with substance abuse, mental health, and intellectual developmental disabilities. They are in partnership with community agencies, licensed independent practitioners, and hospitals. They help the uninsured and those on Medicaid to get comprehensive, effective treatment that is essential for their well-being. East Point, they work side by side with providers and community partners to ensure their members have the medical, social, transitional, and vocational support that is needed. They monitor quality of care and their members' progress. They also staff a crisis support line that is open 24 hours a day, 365 days a year. And the number, as you see, is 1-800-913-6109. Every member they help is ultimately an investment in the health of their 10-county service area. Our team has an extensive list of training modules to address different aspects of adult and older adult mental health care. Our team continuously travels throughout our assigned counties and provide trainings to local and governmental community agencies servicing the older adult population. Our trainings focus on the needs of older adults with mental illness through the community agencies and government such as NAMI, senior centers, nutrition sites, supported by local area agencies and health departments, faith-based organizations, and other invested community groups. The trainings are free of charge, and the continuing education is provided with certificate of attendance. Some of the listed trainings you see, we have dementia, Alzheimer's, caregiver awareness, communication skills and techniques, mood disorders, behavioral health, substance abuse, anxiety and stress, challenging behaviors, crises awareness, person-centered training, psychotropic medications, and suicide awareness. We will now have our qualified mental health profession, Mrs. Crystal Robertson, address stigma and its impact on mental illness.
Hello, everyone, and thank you, Melissa. I am Crystal Robertson, and I will be providing an overview of stigma and how it relates to mental illness. It is our team's mission to help stop the stigma for those who suffer from mental illness by providing training, information, and referrals. First, I will share with you what is mental illness. It is a condition that affects thinking, feeling, mood, or behavior. When compared to all other diseases, mental illness ranks first in causing disability in the United States. Nearly 1 in 5 adults live with a mental illness. People can experience different types of mental illnesses at the same time. They can happen over a short period of time or be episodic. They can come and go with a beginning and an end, or they can be ongoing or long-lasting. Some examples of mental illnesses are anxiety disorders, depression, personality disorders, and substance use disorders. Mental illnesses and substance use disorders often occur at the same time, and sometimes one disorder contributes to developing the other. Stigma is when someone is viewed in a negative way because of a particular characteristic or attribute, such as a mental illness. Stigma is a hard subject for many to discuss, and I'm going to share some tips to help make it easier. Stigma involves negative stereotypes, labels, judgments, and prejudices which can lead to discrimination, causing people to miss out on family and social relationships or good jobs, housing, insurance, etc. Discrimination is when someone treats you in a negative way because of your mental illness. Stigma and discrimination are the most significant challenges that people living with chronic diseases face, leading to a negative quality of life. Some of the effects of stigma include feelings of shame, hopelessness, and isolation, lack of understanding by family, friends, or others, fewer opportunities for employment or social interaction, bullying, physical violence, or harassment, and self-doubt, the belief that you will never overcome your illness or have a good quality of life. Stigma can lead to low self-esteem and a negative attitude towards psychiatric treatment, often causing the person to delay seeking necessary treatment. Here are some ways you can deal with stigma. Do not believe it. Try not to let other people's ignorance influence the way you feel about yourself. Connect with others by joining a mental health support group, either online or in person. Do not hide away. Reach out to people you trust. You are not your illness. Do not define yourself by your illness as other people might. Instead of saying, I'm schizophrenic, say, I have schizophrenia. There is power in language. Everyone has a role to play in creating a mentally healthy community, one that is inclusive, rejects discrimination, and supports recovery. And here are some general tips on talking to others about mental illness. Try to keep awkward silences at bay and don't shy away from the subject. Ask questions, show concern. By talking openly about mental illness, it becomes easier to talk about it, and it becomes easier to ask for help. It makes it okay to have a mental illness. Be nice. It sounds easy to do, but try to say the right things. Be open and caring and let that shine through. Your language and tone of your voice are more important than you think. Make sure that you are actively listening. The fact that you are there for your friend, your family, or your coworker can make a world of difference. Try not to find a solution to the problem, but listen. Focus on asking questions that require a longer response than just yes or no. Listen to what they have to tell you. Continuously show your support by keeping in contact with your friend. Make sure they know that they can always count on you. If they need you, you will be there. Check in with them with an email, a phone call, or an offer to meet up. This shows that you care. Some more ways to challenge stigma are learn the facts about mental illness and share them with family, friends, work colleagues, and classmates. Get to know people with personal experiences who've had mental illnesses so you can learn to see them for the person they are rather than their illness. Avoid using language that puts the illness before the person. And avoid using language, messed up there. Don't say a person with bipolar disorder, but rather that person has bipolar. Share your own experiences if you've experienced mental illness. This will help dispel myths and encourage others to do the same. Mental illness is not something that needs to be hidden. I hope that you found this overview of stigma and mental illness helpful. And now Vicki Hale will provide you with some local resources.
Hello, everyone. Thank you, Melissa and Crystal, for that informative presentation on just what the GAS team is. And as she mentioned, I'm the registered nurse on the GAS team. It's important that the GAS team share our knowledge on mental health and cognitive care topics in the community to help our communities come together to help each other understand what is important about mental illness and stigma that so many people so wrongly label individuals with. So now let's talk about some ways to get help for somebody that has mental illness. There are some online counseling services that can be used from your personal computer or even your smartphone that can work around your schedule. Just research online. And as I put up here some resources, the online counseling services, we have the Suicide Prevention Lifeline, and that number is 1-800-273-8255. The Veterans Crisis Line, again, that same number, the 1-800-273-8255. We have SAMHSA, the Substance Abuse and Mental Health Service Administration, and that number is 1-800-662-4357. And then some other ones, the crisis text line. I thought that was very interesting, that you can actually text for some crisis counseling. And you text signs to 741-741. And they have a lot of free apps that you can search on your smartphone, such as Breathe to Relax. That's for stress management. They have IntelliCare, which helps deal with depression and anxiety. Then you have SAM, Talkspace, and then of course, the ones we fall back to is East Point, and they have the 24/7 crisis line. And again, that number is 1-800-913-6109. So remember, this is our call to action to be the difference. Remember to take a few minutes each day for yourself. Some me time, as they call it, for the best interest for your mental health. We've all been through a lot this past year with COVID and must continue to persevere. Let's find joy in making our mental health a priority. A new saying that I have thought about a lot is do more of what makes you happy. We have to be the difference in helping yourself or someone else that has mental illness. So call our team today to reserve a free training on any of the topics that Miss Melissa discussed earlier in the presentation. Some advantages of taking our trainings are that they are free, and you can't get any better than that. They are full of information to increase your knowledge on mental health topics, and this can help eliminate the stigma that Crystal talks so about. And then classes can be flexible to fit your schedule. Classes are only 1 hour from start to finish. We're not here to report to government agencies. We're only here to increase your knowledge. A lot of people have a fear of that. And we encourage interaction during the trainings and allow time for questions. And by all means, call us with any questions you may have and be the difference by speaking up for mental health. Don't wait another minute, another hour, another day to reserve your free training. Thank you for joining us and have a beautiful day.
Hello, everybody. My name is Melissa Haynes, and I'm one of the health educators at the Wilson County Health Department. Today, I'm just going to talk with you guys about the different services that we offer at the health department, what our health education team does, and just some tips on some healthy eating and physical activity. So at the Wilson County Health Department, we offer free or low-cost services. So many of our services that are offered, we offer them on a sliding fee scale so that people who may have a lower income pay less or nothing for a service that we offer. And we do also accept most insurances at the Wilson County Health Department. Some of the different services that we provide at the health department are clinical services. So we have primary care service, which is what we provide at preventative and acute care services to adults, including lab work and physicals. We also have child health services that are for infants, children, and adolescents. So we include that with primary care or child health visits or well visits. We also provide dental varnishing available with their screening when they come. We also provide family planning services for the Wilson County Health Department, and that includes reproductive health care for males and females. And we also include education and services to prevent unintended pregnancies. In our immunizations clinic, we provide immunizations to adults and children to protect against vaccine preventable diseases. We also have a breast and cervical cancer control program, or we call it BCEP. And what this program does is it promotes early diagnosis and detection for breast and cervical cancer. And we also provide clinical breast exams, mammograms, and pap smear provided if needed at no charge. For our communicable disease services, we provide free and confidential STD testing, HIV/AIDS testing, and counseling and education. We've also been working a lot with COVID over the past year. This falls under our communicable disease branch as well in the health department. So we've been doing a lot of testing and a lot of vaccinations. Our maternal health program at the health department provides quality prenatal care, education, and counseling to expectant women of Wilson County. We also include parenting and social work services through our maternal health clinic. The Wilson County Health Department also provides nutrition and health education services. Under our nutrition services, we have our Women, Infants, and Children program, or WIC. This program provides nutrition education, counseling, and food vouchers to low-income pregnant, postpartum, and breastfeeding women, as well as their infants and children up to age 5. We also have breastfeeding support available through this program to mothers through our peer counselors at the health department. Also under our nutrition services is our registered dietitian and licensed nutritionist. We have available at the health department. One is in our WIC program, and we have one in our clinical services programs, but they are available through doctor referrals to help individuals improve their health conditions. Our health education services include our health education team at the health department. So through this program, which is where I work, we provide educational programs throughout Wilson County. We go out and talk about different public health topics ranging from diabetes prevention, HIV and STD prevention, pregnancy prevention. We also talk about substance use, any type of chronic disease, how you can manage and prevent those from happening. We also talk about our health education services in the community, and we also educate our community on the different services that we provide at the health department. We also assess, plan, and implement these education programs in Wilson County. The Wilson County Health Department has a social work department that provides care management services. So they provide 2 different ones. And the first one is a care management for at-risk children. So this is a case management for high-risk children from birth to age 5 who meet certain risk criteria. And a social worker also helps to provide screenings and referrals for other needed services through this care management program. Our social work also has a care management for high-risk pregnancy program. In this, they provide case management services, education, resources, and referral information for any pregnant woman who is Medicaid eligible. At the Wilson County Health Department, we also have environmental health services. So this includes food, lodging, and institution facility sanitation. So this department does inspections of food, lodging, institutions, and childcare facilities to ensure cleanliness and enforcement of state public health laws and rules. And we also have an on-site water protection that does site evaluations for septic and well permits, septic system and well construction inspections, and well water testing. If you have any questions about the services that we provide at the health department, or if you are interested in receiving any of these services, you can give us a call at 252-237-3141. You can also follow us along on our Wilson County Health Department Facebook page. Our hours of operation are Monday through Friday, 8 a.m. to 5 p.m. And we also offer free language assistance available as needed. So now we're going to talk about some healthy eating. So when I talk to you guys about healthy eating, this is just what is recommended. So as a health educator, I can't tell you exactly how much of each food group you should be eating. That's something that you can consult with your primary care provider or a licensed nutritionist or dietitian. And of course, if you don't have those services, the health department can offer those to you as well. But these are just recommended on the daily 2,000 calorie a day diet plan, so that you see on the back of like nutrition labels and things like that. So these are just recommended things of how much you should be getting. So we'll start with fruits. So fruits can come fresh, frozen, canned, and dried. The best way to eat fruit is definitely fresh, but of course, sometimes that's hard to access. So we recommend for people to try and get it frozen, or if you have it canned, and of course dried as well. So the recommended daily intake could vary between 1 to 2 cups a day for fruit, but fruit is definitely an important part of our healthy eating for each day because it provides vitamins and minerals for us. Vegetables can come just about the same way. They come fresh, frozen, and canned. They also contain vitamins and minerals for us to consume on a daily basis, as well as fiber and folate, which is also a part of our important daily intake for nutrition. So the recommended daily intake for vegetables can vary between 1 to 3 cups a day. And then we have our grains. So when we talk about grains, we want to make sure that people are eating whole grains, or at least half of their grains should be whole, so whole wheat bread and things like that, just because that's the most healthiest form of the grains that we can consume. But whole grains have B vitamins, which play a key role in our metabolism, so it helps our body to process the food, and it also helps us to have, or B vitamins also play a role for us to have a healthy nervous system. Whole grains also can help reduce our risk of heart disease, which is very common here in Wilson County and also on the eastern part of the state. And it also, whole grains help us to have a healthy digestive system. So it helps support our digestive system in our bodies. In grains, the recommended daily intake can vary between 3 and 8 ounces each day. Protein, the recommended daily intake could vary between 2 and 6.5 ounces each day. So everybody can be different. My recommended daily intake could be different than yours, but these are just based off of, remember, the 2,000 calorie a day diet. But protein can include meat. So we're talking about, when we talk about ground meat, we're talking, lean meat. We want to make sure that we're eating the 93.7 or the lowest fat possible that we can. And we also can talk about poultry. So our chicken, we want to make sure our chicken is boneless and skinless. And when we bake or make our chicken, we want to make sure that we bake it, grill it, broil it. We just want to make sure that we don't fry any of our foods. Another protein could be seafood, which is definitely a good source of omega-3 fatty acids, as well as beans and peas, nuts, seeds. So with beans and peas, they actually can fall under the vegetable and protein categories, but they also provide us iron and zinc. So we talk about beans and peas. So for those who may not eat meat or who are vegetarians, this is another way for you to get your source of protein. We want to be careful with our proteins though, because proteins can be high in cholesterol, or they contain cholesterol, and cholesterol is only found in animal sources. So we want to make sure that that's why we want to make sure that we're eating the leanest kind of meats, and we're making sure that our chicken and all doesn't have skin or bone in them to help reduce that cholesterol. And our last food group is dairy. So the recommended daily intake for dairy can vary between 2 and 3 cups a day. So dairy is important because it contains calcium, and calcium helps us to have strong bones. So that's something that's very important that we need for our nutrition each day. But for those who don't consume dairy products, there are other forms for you to get that calcium in. So you can try calcium fortified drinks or food, canned fish, soybeans or other soy products. And you can also eat some leafy greens like collards, kale, turnips, and bok choy. So those are definitely some other options to get that calcium in as well. Just some other recommended daily intake. So we think about our 5 food groups: the fruits, vegetables, grains, proteins, and dairies. But we also want to make sure that we're not consuming too much sodium, sugar, or carbohydrates, right, or carbs. So for sodium, the recommended daily intake is no more than 2,300 milligrams a day, which is actually still a lot, but we definitely don't want to exceed that amount because sodium or salt, if we consume too much sodium, it can lead to high blood pressure and heart disease. So we want to make sure that we're not consuming more than 2,300 milligrams a day. For sugar, the recommended daily intake is different for males and females. Males can have 9 teaspoons and females can have up to 6 teaspoons a day. So a good thing with sugar though is instead of reaching for like a candy bar or a cupcake or a cake, anything sweeter processed like that, you can always reach for fruit. Fruit is natural in sugar, and you can, when you're consuming the fruit, you're also getting your vitamins, minerals. So instead of reaching for the candy bar or a cake or cupcake, you can always reach for the fruit, and that can be your natural intake of sugar. For carbohydrates, it's anywhere between 45% to 65% of your daily caloric intake. So if we're talking that you're eating 2,000 calories a day, for carbohydrates, it can be anywhere between 900 calories to 1,300 or 1,300 calories a day of carbohydrates. Now, carbohydrates is something that our body needs to sustain energy, but we don't need to overconsume or eat too much carbohydrates in a day to where our body can't break it down and process. So we want to make sure that we're kind of staying, at that right spot for the carbohydrates. And for fiber, fiber is something that most Americans don't consume enough of each day in their food intake. So we want to make sure that we're getting enough fiber throughout the day to help with our digestive system. So we want to try and reach for anywhere between 25 to 30 grams from food. So fiber can be found in fruit and vegetables, and of course your whole grains. So that's a natural way that you can take in from food source fiber rather than having to take a supplement for it. And just some key things to take away too. So we talked about healthy eating, but another important part is physical activity. We want to make sure that we're getting at least 150 minutes of physical activity each day. You can break that down to about 30 minutes a day. But the important thing to do is just to keep your body moving. While you're watching TV, during commercial breaks, you can get up and move. Instead of parking close to the store, you can park further away, things like that. And instead of taking the elevator, take the stairs. So we just want to make sure that we're moving our body throughout the day, staying physically active, because healthy eating patterns and regular physical activity can help you achieve and maintain good health. And that's what we want for Wilson County, is for our citizens and our community to be healthy and continue to be healthy. And just remember that all the food and beverage choices you make matter. So maybe let's not drink 4 cans of soda a day. Let's try and fit in a bottle of water and all that, of course, too. So just remember that all those choices that you make that pertain to food and beverages, they matter. And of course, the health department has been busy this past year with COVID-19 relief efforts. So if you need a COVID-19 vaccine, you can contact us. Our hotline number is 252-360-0500. You can schedule your appointment. Right now we have vaccine, Pfizer and Moderna vaccines. So our appointments are available for those who are 12 years and older. So you can call our hotline to schedule your appointment. And of course, again, if you're interested in any of the services that the health department provides, you can call our mainline number. That phone number again is 252-237-3141. Thank you so much, Melissa Haynes, for that useful information. So if you guys have any questions, you can ask us at the end. And if you need to contact us, that phone number is 252-360-0500, so you can schedule your appointment. So now we want to welcome in Amanda Gardner. She is part of the Wilson County Public Library. And she is Assistant Director and Adult Services. She also submitted a quick video so that you guys can view. And let me go ahead and play that for you.
Hello, my name is Amanda Gardner. I am Assistant Director and Adult Services Manager at the Wilson County Public Library. I am pleased to be part of today's health fair and to tell you about library resources to improve your health. The Wilson County Public Library has 6 locations: the main library at 249 Nash Street West in downtown Wilson, and 5 branch locations. East is located on Ward Boulevard in Wilson. There's Black Creek, Elm City, Lucama, and Stantonsburg. We also have a bookmobile that visits various stops in Wilson County. Reading has significant health benefits. Studies have shown reading helps reduce stress, likely because it requires concentration and focus. Researchers at the University of Sussex found that participants who read for just 6 minutes experienced reduced muscle tension and a slower heart rate. Reading helps you sleep better. Reading is an excellent way to relax and can be a great nighttime ritual. The bright light from digital devices, such as a smartphone, television, or computer, can hinder quality sleep, So reading a book is an ideal way to unwind before bedtime. Reading keeps your mind sharp. Studies have suggested that reading regularly may slow mental decline and reduce the risk of Alzheimer's disease. Reading can improve your relationships. It helps you develop empathy toward others. Reading about people who are different from us can help us understand another person's life experience and give us gratitude for our own life experience. It's also helpful to read books about people who have gone through the same things we have. They may have a way of describing their experience that helps us communicate our own experience. To improve your health, try reading a new topic or genre. Cultivating interest and curiosity in new topics can have a positive impact on your health. If you don't enjoy reading for fun, try these tips to help you develop good reading habits. Listen to an audiobook while you complete chores, commute, or cook. Choose a book that has shorter chapters and read a little bit at a time, such as 5 minutes a day. Set realistic goals for yourself. Aim to read a chapter a day or a week. Go at your own pace. If you make time for reading, like you would exercise, meditation, or preparing healthy meals, you can make it a beneficial new habit or hobby in your life. Wilson County Public Library provides fun activities and incentives to encourage reading. Our annual summer reading program will take place June 14th through August 7th of 2021. All ages are invited to register online and to log your reading during these dates. Prizes will be awarded for reading milestones. Teens and adults who read at least 300 minutes will be entered into a random gift card drawing. The teen and adult who read the most minutes will also win a gift card. Log on to our website or our Facebook page or visit any library location to register. Due to the continued COVID-19 pandemic, the majority of this summer's programs will remain virtual. Contact us for more information about the Tales and Tales Summer Reading Program. Each library location has nonfiction materials to help you learn about various healthcare topics and to support a healthy lifestyle. The largest concentration of these materials is at the main library, although you may place holds and have materials sent to any library location. Topics include diet and exercise, healthy eating, mental health awareness, self-help, sexual wellness, and having a healthy pregnancy. All library locations have large print fiction and nonfiction books. These books have a larger font, which can be helpful for visually impaired patrons. Large print can also be helpful for greater reading comprehension and less fatigue in comparison to smaller print. Large print books, like most other library materials, can be placed on hold and sent to other library locations. For some, reading a print book may be difficult due to visual or physical impairments, or some may prefer listening to books in the car or while working around the house. Audiobooks on CD are a great solution. We have a large collection of fiction and nonfiction books on CD. If you're not able to get to the library as often as you'd like, or if you prefer reading on your tablet or phone, you can check out ebooks and e-audio via Access 360. These resources are convenient and portable. Ebooks allow you to enlarge the print to suit your vision needs. Once you download the Access 360 app, you can browse, check out, and reserve ebooks and e-audio. We are continually adding to this new collection. If you need assistance in setting up Access 360, stop into any library location or make an appointment with Adult Services staff at the main library. With a card from any North Carolina public library or from most colleges and universities, you can access electronic research databases on a variety of topics through NC Live. As shown on this slide, there are a number of health and wellness resources to help you learn about diseases, prescriptions, preventative health, and more. There are also professional resources to benefit persons working in health and medical fields. You can access these resources by visiting nclive.org and typing in your library card number. Please contact the library for assistance in using these databases. The main library and branches provide free internet access. Here you can see part of our newly renovated second floor of the main library. We have knowledgeable librarians and staff to assist you with computers, applying for jobs, finding medical information, and using electronic devices. The main library has a low vision magnifier that was donated to us by the Wilson Evening Lions Club in honor of Judy Watson. The magnifier is on the first floor near the large print collection and is a great way to enlarge a letter, billing statement, a contract, or a newspaper. The Wilson County Public Library offers notary public services free of charge on a limited schedule at the main library, Black Creek, and Lucama branches. Please call the library ahead of time to verify a notary will be available. An important goal of Wilson County Public Library is to ensure that all residents of Wilson County have access to our library's staff, services, and materials. Homebound service is for patrons who are no longer able to visit Wilson County Public Library. Eligibility for homebound service includes, but is not limited to, patrons with physical disabilities, disabilities of advanced age, reading or sight impairments, or extenuating circumstances that prevent patrons from using the library in a traditional manner. Qualifying homebound patrons may request fiction and nonfiction books, large print books, magazines, books on CD, and DVDs. Contact the library to learn more about our homebound service. The North Carolina Library for the Blind and Physically Handicapped is a special public library that circulates books and magazines, especially made for persons who cannot use regular printed materials due to a visual or physical disability. The library is located in Raleigh, but mails materials and equipment free of charge to eligible North Carolina residents throughout the state. Certification of eligibility can come from a healthcare provider or a professional librarian. Stop into any library location for an application or call us for more information. These services are not just for the visually impaired, but for anyone who has long or short-term reading difficulties. This could be low vision, or difficulty holding a book for a physical reason, or a learning disability. For example, parents can sign up for the service for a child suffering from dyslexia. Thank you for your attention today. If you have any questions about library resources or services, please contact us via phone, email, or social media. We will look forward to serving you.
And I just want to remind you guys that we just have one life and it's your own. So, we want to inspire healthy lifestyle changes. And I want to remind everyone that it is okay to ask for help. Nobody is alone in this world. And, we just want to take care of ourselves today and every single day. So I want to leave you with this quote. If you look inside yourself and you believe, you can be your own hero too. And that is the purpose of this virtual health fair, to be our own heroes and take care of ourselves. So that way we can spread that amongst everyone else around us. I just want to thank everyone for attending today. I want to thank our vendors, our sponsors, our community partners, everybody that is watching today. Thank you so much for all the help that you have given us and for watching and attending. If you guys have any questions, please be sure to submit them either to myself. You can email me or you can write on this chat, and we'll definitely get back to you once everything is over. So thank you so much. And my name is Estrella. If you are going to pick up your goodie bags or your giveaway prizes, then you go ahead Monday through Wednesday, 9 a.m. to 4 p.m. Thank you.